back to my channel. Today I'm going to be talking to you about borderline personality disorder, specifically what it is and my experience with it. So please stay tuned. Okay, so borderline personality disorder is actually more common than you may know. A lot of people have not heard of it before. It's often misdiagnosed as bipolar disorder, but they're distinctly different because bipolar disorder is an emotional disorder, whereas BPD is a personality disorder. So they're quite different in that sense, but 2 out of 100 Australians will have BPD, so it's around 480,000 Australians, and women are 3 times more likely than men to experience it. BPD by definition is a psychotic disorder that is defined by an unstable sense of self, unstable moods and unstable relationships. A lot of people with BPD describe having it like an open nerve ending because you're just so sensitive to everything around you, and it's painful. It's really painful. There are 9 main symptoms of BPD, so I'm going to go through those with you. I'm going to read them off my phone because they have the memory capacity of a goldfish. So this is according to helpguide.org. The 9 symptoms of BPD are fear of abandonment, unstable relationships, unclear or shifting self-image, impulsive, self-destructive behaviours, self-harm, extreme emotional mood swings, chronic feelings of emptiness, explosive anger, feeling suspicious or out of touch with reality. So I've experienced all of these symptoms. I don't think you need to have all of the symptoms to be diagnosed with BPD, but if you have 5 or more, then perhaps you should consider seeing a psychologist. The causes of BPD are relatively still unknown. Theories are that it is caused by biological reasons, so it's genetic, or social reasons. So if between the ages of 1 and 2 you were not properly socialised or you experienced trauma, that can then trigger BPD. But there's a bit of confusion with that because dissociative identity disorder, which is also known as split personality disorder or multiple personality disorder, is triggered by trauma at an early age before the age of 7. So there's still research going on in that factor. There are a couple of common co-occurring disorders that you may experience because you have BPD, such as anxiety, substance abuse, bipolar disorder, what else? Eating disorders. There's quite a few. I know for myself, I experienced anxiety or depression as well as one, of course. I experienced anxiety, depression and substance abuse. For me, my substance abuse was in food, in alcohol, and I also engaged with risk-taking behaviour. Borderline personality disorder is called borderline personality disorder because it suggests that you are constantly sitting on the borderline of neurosis and psychosis. There are great treatments for BPD, so you can go on antidepressants or anti-anxiety medication, which is what I've done, or you can engage with dialectical behaviour therapy, which is a form of cognitive behavioural therapy which has been modified for people with BPD, and it was actually created by a scientist who experienced BPD herself, and she did not reveal that until she has successfully modified this therapy, which I think is incredible. So according to sane.org, DBT works as, so the term dialectical means working with opposites. It uses seemingly opposing strategies of acceptance and change where the therapist accepts you as you are but acknowledges that you need to work to move forward. It engages with concepts of mindfulness, distress tolerance, emotional regulation and interpersonal effectiveness, which means to engage with assertiveness and dominance in a healthy manner so that you can ask what you need. My favourite method of DBT is pick a colour and choose 5 things in your environment that are that colour when you're about to experience an anxiety attack. So I would typically pick green because I could easily find 5 green trees, but it was enough to distract me from having my anxiety attack. Another method is when you feel an urge to self-harm, hold ice blocks in your hand, and that will get that release of needing to hurt yourself out without actually causing harm to yourself. Okay, so that's my introduction to borderline personality disorder. Please stay tuned. I will be filming a part 2 to talk about the stigma with borderline personality disorder and my experience. But thanks for watching. Bye.